welcome to Pharmazy's pharmacy teaching videos. This video is going to be about the pharmacy pre-reg exam. With the GPhC exam coming up in a few weeks, I thought I'd create a quick video of tips and advice for immediately before, during and after the exam. So essentially the exam week. But before we start, it would be really helpful if you could like and subscribe to our YouTube channel, and remember to turn on notifications to be informed of new video releases. Also make sure you follow us on Facebook and Instagram for posts and quizzes. So advice for before the exam. The week before the exam, prepare and check your equipment, including calculators, pencils, erasers, highlighters, water. Of course, this may differ with the online exam, but in that case, make sure you have a good internet connection, all your computer and laptop equipment work, and daycare is organised if you have kids. Of course, you'll have most of this sorted before the exam week, but double and triple check these just to remove any unnecessary worries or get replacements if needed. Second is sleep. Have a good night's sleep before the exam and trust that your alarm will wake you up. You can of course set a few just in case, however try not to watch the clock as this can really disturb your sleep and affect your concentration the next day. I've heard a lot of stories of people who have failed their pre-reg exam after being fully prepared simply because they didn't rest the night before and were exhausted on the day. If the exam centres do open and you do have to travel for your exams, I also really recommend booking a hotel the night before which is close to the exam centre so that you don't tire from travelling on the day. And finally, before the exam, believe in yourself. You have spent a whole year at least preparing to become a future pharmacist through your pre-reg placement. You may sometimes get doubts that you may have started revising too late, but remember you will have picked up a lot from practice earlier on in the year without even realising it. So have faith in what you've revised, as just before the pre-reg exam is when most pharmacy professionals are at the peak of their general pharmacy knowledge. Moving on to tips for during the exam. Timing is a huge issue for a lot of students and the pre-reg exam can be quite tight for time. This seems to be the case particularly for the calculations paper. So, set yourself timing for when you want to complete a set amount of questions so you have something to aim for. For example, the calculations paper has 40 questions to be completed within 2 hours. And remember, if you don't answer those questions, you lose the marks automatically. So you really do want to answer as much as you can whilst keeping the accuracy of your answers. So what I did in the exam for the calculations paper, for example, is set myself a half-hour time for each 10 questions. I know some of you may think that might be calling it quite close, as you'd finish all the exam questions exactly in 2 hours, but remember some questions are a lot easier than others, so it will take you a shorter amount of time. So cutting up the exam evenly and knowing what you're trying to aim for can be really useful. That way you'll also notice if you're spending too long on a certain question which is throwing you off track, and you can skip that one and come back to it later. Bringing us on to our second point of not getting caught up on one question for too long. If you don't know it, guess a reasonable answer from the answer options using your common sense and flag or highlight to come back to that question at the end. Remember, each question is weighted exactly the same as the other, so that one question, if you spend too long on it, can cost you answering multiple questions that you actually know the answer to later on in the paper. In terms of making a reasonable guess, the reason I suggest this is that by guessing you have nothing to lose if you run out of time and don't manage to come back to it at the end. Similarly, if you find that you haven't answered everything by the last 5 to 10 minutes of the exam, go back and guess. This may not be possible with the calculations paper because you have to work out the answer for yourself, but for the clinical paper, you have an opportunity to get the answer right rather than just leave it blank. Remember, there's no negative marking in the exam. As a side note, some people do prefer to look for questions that are their strengths, especially in the calculations paper, and to start with them first. For example, they'll start with questions such as calculating the number of tablets to dispense given the dosing on a prescription, or they'll look for the creatinine clearance question as they've practiced this a lot. Again, this could be a useful method, but not one that I personally use, as it can confuse which questions you've answered from which ones you haven't when you're sitting the physical paper. And finally, trust your instinct. Where you can eliminate some answers in the clinical paper but are stuck on choosing the final answer, trust your instinct. Most of the time, your first instinct when you read a question is the answer that is correct and the one you should go for. And finally, tips for after the exam. Of course, as you'll be aware, GPhC exam questions are not to be replicated and spread around, as that can lead you into serious trouble. However, needless to say, a lot of students after the exam do discuss their answers with other students who sat it, especially directly outside the exam hall. However, my personal recommendation is to avoid discussing exam questions, for the simple reason that it can really make you doubt yourself if someone gets an answer that doesn't match yours. The fact is, although you may later on learn of the true answer, the GPhC has procedures in place to review all questions and answers post-exam. So that question you spend time discussing and worrying about may even be removed from the exam for ambiguity or because there's a split in respondent answers. Another reason is discussing answers can also give you a false sense of security or make you worry unnecessarily when you don't have the full picture until the results are released. So my advice is, don't discuss, but if you do have any particular worries, organisations such as the PDA do gather feedback post-exam and you can raise your concerns to them. Similarly, you can always email the GPhC directly for further advice. And finally, relax and enjoy the rest of your placement and the summer. You've done the best you can and that's all you can do. Even if you do have a feeling that you may not have passed, try not to worry until you actually get your result, and there will be a lot of support options for you. But for the time being, remember pre-reg isn't over, so give yourself a well-earned break, then focus on making the most of the rest of your pre-reg year, including getting all your final paperwork completed and learning as much as possible about being a future pharmacist. So best of luck to everyone sitting the GPhC exam soon. As always, please make sure to like and subscribe to our YouTube channel, turn on notifications, follow us on Facebook and Instagram, and let us know of any feedback or requests you may have. Thank you.